My name is Senator Evan Vickers. I represent District 28. I'm also the Senate Majority Leader, and we're talking about Senate Bill 195, which is discussing the emergency powers that's happened in the state and what we want to do to look differently in the next pandemic or the next long-term emergency. So the bill has been a work in progress for about 8 months, involving a lot of legislators, also the executive branch and other interested groups like Libertas and others that have input on learning from what we've gone through with COVID. Okay, the bill specifically governs how we would do it in the future situation of a long-term emergency. It provides a lot of more input from legislators, a lot more involvement from legislators. It provides public input, which we do not have that opportunity now. It provides good checks and balances on the governor and the public health department, and also the local health department and local governments. It gives more flexibility to the local government entities to work with it. It specifically allows the legislature to have oversight over the legislative powers that are being used by the governor's office and the public health department. We need to clarify that every power that's been used in this pandemic and will be used in future long-term emergencies are legislative powers. They're not executive. They are not health department powers. They are legislative powers, and so we need to make sure that we have that type of oversight. So existing public health orders would still fall under what's going on right now. We are looking at what would happen in the next emergency we've had, and that's hard. Looking back through what's the experience we've had with COVID, good or bad, now we have to look forward with the lens of, okay, what would we do next time? And that's looking forward, but it would be drastically different. It would have a lot more public input, it would have a lot more flexibility, a lot more legislative oversight, a lot more local government oversight, and so it would be significantly different than what's happened in the past. But at the same token, we don't change what on a regular everyday emergency you might say, whether it be a chemical spill or a wildland fire or anything along those lines. Even quite frankly, in a long-term emergency, in the first 30 days, the governor's office, the public health department, the state public health department, the local health department, or the local government can do what they need to do to address that. But from that point on, then it steps into a new arena where there's more political oversight by the legislature and local government. Well, I've seen what's happened with COVID. Fortunately, Utah's come out of this very well. But there's been a lot of concern in the public about different things, about whether it be a mask mandate or a fine on a business, all those things, the whole arena that we've gone through. And a lot of people, it's interesting because you have people on one side that feel like we haven't done enough, people on the other side feel like we've done too much. But the bottom line is we just have not had a good policy that allows us to govern and have the oversight that we need to going forward. And so it's just apparent that we needed to address this. So we put together a working group in the Senate, including myself and 5 other legislators, and then the House, a similar group, been working with the new administration, and quite frankly, they've been very good to work with, Governor Cox and Lieutenant Governor Henderson, and working with others as we've gone through. Now that the bill is public, we've addressed some of the issues going forward, or just a couple of refinements we're working on today, and then we'll start moving the bill forward.